Dr. Weber, thank you for joining me this afternoon. I'm looking forward to learning more about the work you and your team performed around this multi-state outbreak of fungal meningitis. Now, this was something of a medical mystery, correct? Can you tell me a little bit more about what made this different from, say, a more typical outbreak?
Sure. So thanks for having me here today to talk about this. So it was something of a mystery. We had an astute clinician who first detected what might be happening and had the first idea that there might be an exposure to a medication. And as it turns out, these 14,000 patients were exposed to a steroid that had been made by a compounding pharmacy in Massachusetts. Compounding typically is a medicine that is made for an individual patient based on a prescription that suits their particular need. But this was really a case of manufacturing, and it was done in conditions that made us quite concerned that there could be contamination of a variety of sorts. And as it turns out, the medication was contaminated with a fungus, and that was the principal cause of this meningitis. This is not a meningitis that spreads from person to person. There was no danger that this was going to be transmitted to families or to friends or to colleagues. This was strictly limited to the very large number, but nevertheless strictly limited to the people who had injections with this medication.
So let me follow up on that a little bit more, because communications, even on a small team, can be difficult. And I think, as you alluded, your team included hundreds of people from the CDC, from the FDA, state officials, and then, you know, even more broadly, you know, hospitals and healthcare providers all across the country. So you mentioned one thing you did in terms of bringing together the leadership team maybe a couple of times a day. What were some of the other communications techniques that you used to keep people not just aware of what was going on, but to really communicate around decision making?
So I guess there's two kinds of communication, which maybe you're referring to. So there's the internal communication, and that, I think, you know, fell on my shoulders, among others, but to be ready to listen, to hear dissent, whether that was in private or in our sort of group meetings, and, you know, to make sure that people were really informed of what everyone else was doing, because it would make an impact on, you know, if there was sort of epidemiological information being collected, the clinical team needed to know that. If the clinical team was going to recommend certain diagnostic procedures, that might have an impact on surveillance and other things. So I think it was regular meetings. It was making sure that team leads filtered that information down to their the people they were supervising or were on their teams, and being able to pick up the phone and get our other agency colleagues' attention over things and do things very quickly. But the other very big communications challenge, which I think we met successfully, was with the public. And we were lucky to have an extraordinary communications team. Many of whom came from the division I work in. And they produced materials for the internet, whether that was just on CDC's website, whether that was interviews, videos. We put out what we call Health Alert Network notices as we learned more about the outbreak. And they just did a tremendous job of making sure that all the sectors we were concerned with, just like you say, frontline clinicians, hospitals, purchasers of medicines from compounding pharmacies, state officials, other agencies. I mean, our communications folks worked very closely with FDA's communications folks. Everyone knew what we were going to be saying. There were no surprises. And I think their ability to communicate what we were doing and what we wanted people to know was, you know, as good as I've ever seen at CDC.
You had the benefit, in some respects, of a crisis. It created a sense of urgency that allowed people to remain focused on the goal, to communicate effectively. If you were to generalize this experience from the meningitis outbreak to sort of the more typical challenges that folks might experience within HHS more broadly, what do you think might be some of those critical success factors that they could replicate on a daily basis?
Well, I think you know, the idea of being ready to evaluate what you're doing at any time to either whether that's planned or taking a pause in what you're doing, seeing if what you're doing is really working, getting outside opinion, whether that's outside the group that's working on it within your division, whether it's something outside the division, whether it's someone outside the government. You know, is this the way that we should be doing things? Is there another way that we could be doing things? I think really having an open mind about how to approach problems is the secret to success, because like this, even an outbreak of much smaller scale, just one person typically isn't going to have all the best ideas. It's going to be several people or more. And we had that opportunity to really draw on the brains of many, many, many people with many different backgrounds. And I think that would be true for an outbreak of any type and any project. Sure, there are individuals out there who can innovate on their own, and they do all the time. But in public health, it's not a one-man show. It's a team effort. And making sure that those members of the team have their chance to be critical of how things are going and get a fair hearing allows us to take the best ideas and change what we're doing to make it work better.